living in an era where public trust in healthcare is being tested, from viral misinformation to AI in the exam rooms. As the 180th president of the AMA, Dr. Bobby Mukamwala sits at the intersection of medicine, misinformation, news headlines, AI. And so I think this is a really exciting conversation to have. So thanks for joining me here at Health in Las Vegas.
No, thanks for having me. And you're right. I also 100% agree that this is a very important conversation to have so we don't get caught behind all of this evolution and challenges. We should be on the front line dealing with it, predicting what's going to happen and do our best to make it better.
Yeah, 100%. You are here at Health. Is there any agenda you're here with, or are you just kind of observing and seeing what's out there? I know y'all maybe have an announcement today as well, but like what kind of perspective are you coming to help with?
Yeah, so I've got my stage time later this afternoon, and it's about the shortage in the physician workforce, the shortage in the healthcare workforce, and what that means for the health of our country. And so I'll be up on stage with the head of nursing and the head of dentistry,
Okay.
so that we can talk about what is the consequence, why do we have a shortage, and what is the consequence of that shortage. So a very specific reason to be here. But the amazing thing about being here is that when we walk around this room that we're in and see all of the creative solutions for improving all the different aspects of where our healthcare needs improvement, sometimes it's cutting edge, we're in a good spot and we want to be better. And sometimes it's, you know what, we're really suffering right here in this particular facet of healthcare. And this is what we should consider doing to make it better. So it's need to be part of all these conversations. But yes, that's my
Yeah.
stage time.
Yeah. I know you all announced something around digital health and AI today.
Yep.
What, from your perspective, what role does that play in the physician shortage? Does it play a role?
Yeah, it definitely, there's multiple tools to sort of improve the healthcare of our country when one of the major headwinds is that we don't have enough doctors.
Yeah.
Right? We're going to be 80 some thousand physicians short within the next decade, and it's predicted to be more than that. And we're living longer with chronic disease, right? I myself got recently diagnosed with brain cancer. Instead of living for 10 years, I'll probably be around for who knows, maybe 20. But what does that mean? That means that I need more neuro-oncologists to help me with my health, right? If I have stage 4 breast cancer, right? I need more oncologists to be able to maintain that health. And so that's why the physician shortage is going to have a massive consequence in the health of our country. And so, yes, that's a very important aspect to talk about. And that's why the AMA has started to sort of look at how can we help doctors take care of their patients. And digital health and AI is one of those tools. It's not the only solution, right? We shouldn't put all our hope in that aspect of the evolution of healthcare is solving all these problems, but it's a critical part of it.
Yeah.
Right. I mean, I think it's amazing to think that now in my office that I share with my wife, Nita, she's an OBGYN, I'm an ENT. We've had electronic health record since before it was kind of required. But the main reason we did that is we just didn't want an office full of paper charts and then have somebody whose last name begins with an M accidentally gets put in the shelf of somebody who begins with an N
Yeah.
and then lost for months, right? So that's why we switched to digital health. But now you look at the evolution of that and how critical it is to have something that's a portable medical record for this patient. And when I think about how that evolved, I think it could have been much better had physicians had an input. Like, for example, Nita and I still use that EHR. And if somebody vacations for the winter time and they go from Michigan to Florida, their medical record literally gets faxed to their doctor in Florida. That's ridiculous.
Yeah.
Right. Here we are in 2025 and we're faxing our medical record. Nobody that I know in the white collar world uses a fax machine anymore except doctors.
Yeah.
And so because we weren't involved in the evolution of EHR, that's what we're dealing with.
Yeah.
That's why we badly want to be involved in the evolution of digital health and AI so that when it's a finished product, as it's an evolving product, because it's not going to be done, it's going to continuously evolve. Physicians want to be part of that conversation from the beginning. And that's why the AMA has announced today that we're now going to have a council that basically advises and helps us stay involved in the development of amazing technology. So it always stays as augmenting our ability to take care of our patients instead of being an artificial way to take care of patients. That's what AI stands for us.
Yeah, I love that because with EHRs, we've all been complaining about how burdensome they are. You didn't have to do that always. Burned out and whatnot. And that's because, like you said, we weren't involved.
Yep.
And I do love that, you show up to something like this and there are many physicians here. There's physicians involved in, all types of aspects of AI, which is exciting because I feel like that wasn't the case with other technologies we have in the past. My one question is, so like I use our Indian scribe in the ER and I love it. If I can look at the patient, spend more time with the patient, I don't see like double the amount of patients, but I feel like that experience is both better for me as
Yep.
a clinician and the patient hopefully as well.
Yeah, I mean, even like the AI that we just started using in our EHR, this product we've had now for 18 years, it was just within the past month that the guy that created this product, and this is a local guy, right? I mean, this is something that's in our backyard that we got it all that time ago, and he continues to evolve it. We added an AI button
Yeah.
at the top of that page, where now instead of sitting there and typing and looking over at the patient and looking back at the keyboard and typing, I can literally push a button, look at my patient for the entire time, just like I did 25 years ago.
Yeah.
And then the note is generated. I can verify it. And that's wonderful, right? And that's just the most basic example of AI. In this room, when I tell that story, they're like, dude, what are you talking about? We've had that for 10 years.
Yeah.
I'm like, yeah, but I just got it because I'm a blue collar doc in Flint, Michigan in private practice where the finances of being a doctor nowadays is so challenged
Yeah.
that as amazing as your product is that you have in one of these booths, I can't afford it, right? The math just doesn't square. And that's another big priority of the AMA
Yeah.
is to help us take the best care of our patient. And if the compensation doesn't even keep up with maintaining what I have, let alone getting some amazing product that I see here today, that's a failure.
Yeah. And how do we do that? Like, for example, I'll pick up PRN shifts in rural hospitals, right? And we may not have certain specialties on call, or, you're transferring patients. And like you mentioned, the things that are in this room are, yeah, they exist at like level one academic medical centers in the middle of Houston.
Yeah.
But in Columbus, Texas, 50 miles down the road, they couldn't even think about this. And even when I use my AI scribe, the other docs, they're like, oh, where'd you get that from? How can I sign up? Like, even that is like an innovation. It is to me as well, but to them, it's like, how did that happen? So how do we make sure that those under-resourced places don't get left behind and are benefited, and they could probably benefit the most from these technologies if they were, like you said, affordable?
Yep.
How does that happen?
Yeah. I think the short answer is that happens in Washington, D.C.
Yeah.
You know what I mean? Like it's not something that a given institution is going to say, you know what? Yeah, they're struggling out there. We're going to give up some of ours so that they get it. That's just not how it's going to work. Never. And so this comes from Washington, D.C. And so their investments into access to healthcare for people in underserved and rural areas is critical. And the AMA has done a ton of work in talking to our lawmakers about the consequence of things. Like if you're pregnant in a rural area and you have a shortage of OBGYNs, and now you have to travel an hour for your delivery, that's going to be a problem, right? And when I travel the world looking at how healthcare is in the rest of the world, because I represent the U.S. at the World Medical Association, and I look at something basic, or we should be basic, like maternal mortality, and where we rank relative to the rest of the world, it's pretty bad, right? And that's not just if you're in the middle of Montana, far from the nearest hospital, but also if you're on the south side of Chicago, where you don't have an OBGYN.
Yeah.
Right? So it's rural, it's urban, and everything in between, the consequences of these things. So how do we fix that? We have to let Washington, D.C. know what it's like to be boots on the ground and dealing with the death or bad consequence of a patient that could have been avoided if there was better planning and better investment in the care of patients wherever they live, whether that's Manhattan or the middle of Montana. All should have better access to care.
Yeah. And I think as, like an average person growing up, you think that because we're the United States, we do have the best healthcare. But like you mentioned, you look at all the rankings for various statistics and one, and I'm like, wow, we're not even close to having the best healthcare. Obviously, you're a big part of us getting to that point where we can proudly say that.
Yeah, I think on that note, it's an amazing place to be when you have a particular diagnosis.
Yeah.
Like you mentioned, I have this grade 2 astrocytoma that I got diagnosed 10 months ago. This is an amazing country to be in so that I could have access to have my craniotomy and my surgery done within weeks of me needing it. Now, that's better access than the average American.
Yeah.
But if you have a brain tumor, this is a great place to be.
Yeah.
If you are pregnant in a rural area, not so great.
Yeah.
Right? If you have stage 1 hypertension and you want to prevent that from turning into a stroke or a heart attack, then we're not a great place to be.
Yeah.
Right? If you have prediabetes, and that's the way you live, your family history, your environment is going to take you down the road of becoming a fragile diabetic. That is something that we should invest in the prevention of disease. And yet that's not what we do. So I'm kind of interested to see what comes from Washington, D.C.
Yeah.
in the whole concept of make America healthy again, right? Like that's an interesting phrase that I totally would love to see happen. How does that happen? the devil's in the details.
Yeah. Yeah. What kind of coming into this job, and you kind of brought it right up, Maha, and obviously we talked about digital health, and we're going to talk about social media here in a bit. But obviously, a lot of things on your plate. What was something that maybe you didn't expect, that even you knowing that this was a big undertaking that you were about to undertake, but that you didn't expect, and you're like, oh wow, I didn't even realize that, even though I've been involved in medicine and organized medicine for a while now.
Yeah, I guess I look at it from a slightly different perspective in that, preparing for this role as president of the AMA, right after serving on the board as being president-elect for a year,
Yeah.
the priorities of the American Medical Association, which are developed from our House of Delegates, right? So almost 1,000 doctors that say, this is what I'm seeing, this is what I'm experiencing, this is what my patients are suffering from. Becomes the policy of the House of Delegates.
Yeah.
And within that, those, 1,000 ideas that we have to tell us what we should work on and what policies we should have and what principles we should have, there's going to be some that take the highest priority, right? Dealing with things like prior authorization, dealing with things like compensation for Medicare in a way that keeps up with our cost of providing care to our patients, dealing with things like a team-based healthcare system, right? Something where there's a physician involved instead of having somebody involved without a physician that has less preparation to take care of a patient, right? The scope of practice work. And so these were all sort of the main goals that we were working on right now. And then all of a sudden I get a brain tumor, right? And so that was something that was a curveball. And after experiencing and navigating, realizing, man, I had amazing access to care, and neither of my neighbors on either side of me would have that access to care. That was the curveball that made me realize, you know what, this is going to be a major theme of something that, yeah, I knew that was an issue, but when you're on this side of that and suffering from the consequences of a problem, yeah, it becomes a passion to try to solve that problem. And so, yeah, that was the unexpected part.
Yeah. Um, it's good to see you healthy in here. So I just wanted to say,
Good to be here. Thank you.
so one final question on the digital health front. I have some colleagues that are maybe afraid, and we all hear about them, that are afraid of like AI maybe replacing us in some way, like radiologists, or, AI being used for things that aren't so great when it comes to billing and whatnot. And they want to shy away from it. And, in my conversations with them, I say, even if you don't like what it's doing, be a part of that conversation. What do you say to them, to the folks that are maybe like, I don't want any part of this. Maybe I'm in the last 10 years of my career. I'm gonna just like,
Yeah.
get through this and get out of here. What do you say to those folks?
Here's the first thing I would say, and this is just me being blunt. If this was a colleague of mine or a friend of mine or somebody close to retirement, like an uncle of mine,
Yeah.
I would say, oh, are you a member of the American Medical Association by chance? And, 80% of them will say no.
Yeah.
And I'll say, well, I think you should join because exactly what you're concerned about is exactly the things that the AMA works on.
Yeah.
Right. So we don't even refer to it as artificial intelligence. We call it augmented intelligence for a reason. It should help you to help your patients. And don't worry about it replacing you, because when the AMA has a chance to convey our perspective on the role that AI plays in patient care, in healthcare, you will understand that, you will like it, and it'll make you proud to be a member of the AMA, because we want the best patient care that should augment your ability to take care of your patient. And so that's the polite sort of
Yeah.
what I would tell them to do.
Yeah. So I make a lot of social media content. We're obviously in the influencer lounge. It's around everything from health tech to medical misinformation to, hey, should you come to the ER for your foot hurting or whatever it may be. We're in an interesting age, right? People turn to TikTok or Instagram for their health information. Just from your perspective, what is the role of the everyday physician when it comes to posting on social media? Is it something that we should do? Is it something that's more personal? What is your kind of perspective on what social media as well is in medical information, misinformation, and what the average clinician should look at it as?
Yeah, I think it has a huge role. And just like with anything, like AI, there is an amazing, useful way to use it. And then there's a way that isn't actually good, right? If it's not developed properly. So in the same way with social media, I think there's the potential for it to be extremely useful to a patient trying to navigate the science of healthcare, right? And what they should do. Should I get a COVID vaccination, period? Should I get an update? It's only been, 1 year. Do I need an update? Things like that. And social media can be an extremely important source of the answer to that question. But chances are nowadays, from what I've seen, it's going to be kind of a screwed up source of information, right? At least if you're looking at science to be the basis of that. And that's why I think it's critical to have an opinion and a goal of making it stay in the useful side of things as opposed to the not so useful side of things. And that's not something that The AMA historically, like any sort of academic center, academic focused organization, would put out a white paper,
Yeah.
right? And they would be on the internet, and maybe 2,000 people would look at it and be like, that's interesting. But if somebody with the opposite perspective, right? So let's say this white paper had a hypothesis and a result in a discussion about why we should do X. And then somebody on social media says, no, we shouldn't do X, we should do Y. And the way of putting X out there is with a white paper. The way of that guy putting Y out there is with an amazing social media presence, you know, good looking person,
Yeah.
amazing background, perfect lighting, great audio, a million hits, but saying something that the science doesn't support. That's a problem.
Yeah.
And so that's why the AMA totally sees that. And that's why now, as president of the AMA, I have the equipment in the studio at my home to be able to put stuff on social media that's founded in the science that we want to see drive people's decisions or help them make those decisions. And so, yes, we are involved in the same process, trying to leave good information and good advice to our patients, to those people that want a scientific based thing, as opposed to wanting to have 2 million hits, more hits on social media.
Yeah.
That's why now I focus on what my haircut looks like and how much makeup I have,
Yeah.
because the reality is that's important to make people comfortable listening to your scientific perspective.
Yeah. Obviously, I don't know if you or anyone has the answer to this, but we are in an era, like we've been talking about, where there's a lot of bad information out there, and sometimes outpaces the good information. What do you think us as an establishment, the medical establishment, did wrong? Did we do something wrong? Did we not adapt enough? Did we not pay attention to it quick enough? Or like I mentioned, you may not have the answer, but I'm just curious, where did it go right?
Yeah, I don't think it was. I mean, I guess if we could predict the future,
Yeah.
right? If we knew that after this virus hits us, this is what's going to happen on social media, that things that are usually totally science based and patient physician relationship based and science based will become something that is social media and media opinion based. If we could predict that, then sure, absolutely, right? I would have had a better suit and more makeup and a better camera in my house right away as president elect at that time, or whatever position we had at that time. But we didn't have that crystal ball to tell us that.
Yeah.
And so then we're playing catch up. We're like, now that this is how patients and the public are getting their information, we need to have a presence on there. So, I mean, I guess you could consider it a mistake that we couldn't predict the future, but I would just say that's reality. So, yeah.
Yeah. What's your personal favorite social media platform choice? Do you have one?
Well, this is going to give away my age, but it's usually Facebook.
Yeah.
But I think literally when you say that, you automatically know if somebody is like over 48, 50 years of age or in their 20s or 30s.
Yeah.
But that's the one that I was always most comfortable with. And but now, of course, the AMA is not depending on my intelligence
Yeah.
and my ability to navigate social media. I mean, that's our goal, is to meet people where they are. And if that's on Instagram, if that's on Twitter, this is on Facebook, that's exactly where we put the information that we would like to share to improve the health of our country.
Yeah. Well, I think Facebook's come back to you. So like I keep tabs on all the platforms, and Facebook audience engagement, it was down for maybe like 5 years from 2012 to 17, but last couple of years it's been crazy. I'm posting on Facebook more frequently too.
All right. Well,
So
good to know.
yeah,
You'll see me there and I'll see you there.
exactly. What is there a role for hospitals, maybe medical schools, creating a curriculum or maybe even like a guide for the everyday clinician to get out there, right? Like we love talking to our patients. We love giving them good science-based information.
Yeah.
Like you mentioned, you may put a video out there and 1,000 people see it. You're not going to see 1,000 people in a clinic day.
Right.
Is there a role for, organizations like AMA to support us where maybe you've never used social media and you're like, I want to get out there and put out good information?
Yeah.
Is there a role? And if so, what does that look like? I mean,
Yeah, and it's an interesting question, and I don't know that we've done it all the way to the point of preparing medical students and residents for social media as a way to have conversations with their patients. But the AMA has been very involved in just looking at the traditional scientific curriculum, right? Like M1, M2 year in auditoriums, and M3, M4 year in rotations, and then off you go with your degree and start your residency program. Totally unaware at that graduation about the health system itself, right? How do things work beyond the science, right? Things like prior authorization.
yeah.
Like, how do we deal with the fact, I know I got to get a PET scan, I know that's the answer to my board examination question. Yes, I passed my board examination questions, but what do you mean I can't order because of prior authorization, right? We have no knowledge about that. And so we have the AMA put in the curriculum of any medical school that's willing to take it. That number is growing, an entire text on health system science, right? So teaching medical students how to navigate that. I'll have to check and see whether there's a social media chapter
Yeah.
in that. Probably not, but not a bad idea to say, hey, if your goal is to, just like you said, help more than 25 people a day who have appointments in your office, but help 2,500 a day. This is a vehicle to do that, and this is how you should navigate how to use that vehicle. Not a bad chapter to add. I'll look into that.
Yeah. I don't think everyone needs to be an influencer, and
Those that are interested.
no, yeah, but those that are interested, it'd be cool for them to have some type of guardrails and
Yep.
kind of good practices to, hey, don't get in trouble with HIPAA, don't get in trouble with their hospital, but this is how you could do it.
Yes.
What makes you optimistic about medicine, and what's one thing that you are maybe a little fearful for or a little cautious about over the next couple years?
Yeah, I guess what makes me optimistic is that when you do a survey about satisfaction with healthcare, from what I've seen, is not a very good number.
Yeah.
Right? Like every time when I go to my office, and I live in Flint, Michigan. It's an office I've been working a small town office for 25 years. And my patients find out that I'm going to spend 200 days a year on the road traveling as the AMA president. Their gut reaction, their initial reaction is, what the heck? Who am I going to be able to see? But then as soon as they think about it for about 10 seconds, they're thankful, right? They're expressing a thankfulness that, thank God you're the president of the American Medical Association,
Yeah.
to share with the rest of the country what it's like to be at this point in the patient in a healthcare system suffering, right? And so that's what I think is what I'm optimistic about, right? So the ability of a institution, an organization like the AMA, that I happen to be the camera and microphone guy of this year, to be the voice that helps the patients in the most direct way. Like I look at everybody involved in healthcare and the technology, the amazing technology that we see here in this building today, insurance companies, hospital administrators, pharmaceutical companies, the technology companies. Nobody is more connected to the patients than we are.
Yeah.
Right. And so my optimism is that when in conversations like I have with my patients in my office, in conversations that the AMA creates by the output that we put there and engaging patients in the solutions that they are desperate that they need to see, that's what I'm optimistic about, is that patient-physician relationship will take us in the direction that we want to go. I think it's behind. I mean, again, a lot of times I say I feel like David versus Goliath, but David won. And so I'm hoping that that patient-physician relationship takes us to a better place.
Yeah. Well, I'll say I'm not envious of your job. Like all the things we spoke about, there's a lot of things on your plate. I'm glad there's someone that wants to do it. So, thanks for standing out there and talking about the things that need talking about. And
Well, and thanks for talking to me about it, because my audience in my small town is minimal compared to your audience. And I think the more people that hear conversations like these, the more I think they like to hopefully go down the road in the same direction with the same motivation that we at the American Medical Association and I have.
absolutely. Thank you so much.
Thank you.
Awesome. Thank you.